my name is Emmanuel Garcia. I'm here to talk about my speech of the importance of hand hygiene in healthcare facilities. So, the reason why I want to talk about this hand hygiene in the healthcare facility is because me and myself, a PCT or patient care tech, I work in a hospital taking care of patients, and I believe and truly believe that hand hygiene is very important because I'm taking care of patients and taking care of their care. I'm gonna make sure they're nice and clean, and I'm nice and clean, so we don't spread infectious diseases to other within the hospital. So HAIs or healthcare associated infections. In 2020, the CDC published data about 2 million patients or people in the hospital get infected, and roughly approximately 99,000 people die due to the lack of hand hygiene or failure to not clean their equipment that is provided to help and care for your patients. So it is very important to us that we are very much taking care of you while we're taking care of us. So the World Health Organization, the Joint Commission, and the CDC recommended that hand hygiene is the number one way to prevent infections. In 2002, the CDC published the hand hygiene guidelines for healthcare facilities. So using hand washing explains that we should use lukewarm water and antibacterial soaps for 20 seconds to make sure we are cleaning around our hands into our upper arms, so that we don't get to spread more illness or infections. And also to use alcohol-based hand sanitizers, so we could, if we don't use, use too much hand washing to break down our skin, and also to make sure we cut our nails to a certain point to make sure that it's not long, because if we have long nails, we could actually have bacteria growing under them, and that could also lead to infections into the future. The reason why we're doing this is because we don't want to have an outbreak. Since we just came out from a pandemic outbreak of COVID-19, and the cause of it is due to lack of hand hygiene that we could have done better to prevent it. Everywhere we go in public, to everything we touch, such as doors or equipment that we use in public, that we do not wash our hands after. We have to make sure we wash our hands with alcohol or hand washing after everything we touch from the public. In 2009, the CDC published isolation guidelines, PPEs or personal protection equipment that I get to use to take care of my patients if they're in isolation or the airborne contact or any enhanced isolation that they are having. So I get to wear gowns, gloves, a mask, and face shields to make sure that I don't get to spread that disease onto the hospital itself. Also, you're going to, or maybe you're visiting a loved one, going to a hospital that contains small or big units, rooms from 8 rooms to 40 rooms. And for me and a patient care tech, I have to make sure that you are safe, and I'm making sure that we're safe as well. So I have to wear the PPE in order to keep us safe and not to spread any viruses like C. diff. C. diff is a very complicated bacteria that can spread to easily. It can give you radical diarrhea if it's not contained right. That's why the PPE is very much important. We cannot use alcohol. We have to use hand washing in order to get rid of that bacteria. In 2014, Shea published their strategies to prevent HAIs in healthcare facilities, to make sure that we have to follow guidelines to make sure that we can spread and make sure we could improve our ways of hand hygiene. And I want to explain that I want you to understand that if you're going to visit a loved one, or maybe you're gonna be in a hospital, make sure that you are doing hand hygiene, because you're going to be visited by healthcare workers, from like doctors, nurses, from PCT such as myself, or labs, or anybody that's going to be working in the hospital, that they're going to be visiting you in and out from other patient rooms and going to your room. And also to make sure that you're going to you have EVS or environmental services to help clean and disinfect your rooms every day, so you don't get any bacteria to spread it to you. And that is it for my speech, and thank you.